Hello YouTube, welcome to Dr. Vibes. In this video we shall study about the lymphadenopathy and the Viva questions that are usually asked from there. First question, what is lymphadenopathy? Lymphadenopathy is a change in the shape or size or consistency or mobility of the lymph nodes. One example of each, change in the mobility, lymph node becomes non-mobile or hard in case of malignancy. Change in the size, lymph nodes increase in size in various conditions like infectious diseases, autoimmune conditions, which we will see later. Lymph node becomes hard in case of malignancy, that is change in the consistency. Normally, it is softer form. Lymph node changes in shape. Normally, they are discrete, but they become matted in case of tuberculosis. Second question, what is generalized lymphadenopathy? When lymphadenopathy is present in more than two non-contiguous group of lymph nodes, then it is called generalized lymphadenopathy, or if the lymph node of the supraclavicular or epitrochlear region becomes palpable. What do you mean by non-contiguous group of lymph nodes? Those group of lymph nodes which have separate lymphatic drainage. For example, cervical, axillary, inguinal, these three have separate lymphatic drainage. Question number 3, rubbery lymph node is seen in Hodgkin's lymphoma. Fourth, matted lymph node is seen in, as I told you, tuberculosis. Periadenitis in case of tuberculosis. Next, fifth question, what are the causes of lymphadenopathy? So whenever this question comes, you can divide it into two broad headings. One is localized cause and one is generalized cause or systemic causes. Now localized cause, I will tell you when we discuss the particular group of lymph nodes. Now, what are the systemic causes? You go by infection. In bacteria, you have tuberculosis, syphilis. In virus, you have HIV, CMV, Epstein-Barr virus. In parasite, you have toxoplasmosis. Fungi, you have histoplasma. Next is autoimmune condition like SLE, rheumatoid arthritis, sarcoidosis. Then you have neoplastic conditions like lymphoma, Hodgkin's, non-Hodgkin's lymphoma. Then you have some certain drugs which can cause lymphadenopathy. So this summarizes the systemic causes. Mainly you go for infectious, autoimmune and neoplastic causes and mention some drugs. Sixth question, name the different cervical nodes and where do they drain? Now there are 6 group of cervical lymph nodes. 1A submental, 1B submandibular, 2 is upper jugulodigastric, 3 is middle jugulodigastric, and 4th is lower jugulodigastric. This is present in the anterior border of the sternocleidomastoid muscle on either side. 5th group is the posterior triangle of the neck, and 6th is the pre and the paratrachea group of cervical lymph nodes. There are other also which are not given any specific group or level, but they are the pre and post auricular occipital group of lymph nodes. Where do they drain? Now just imagine submental will drain your teeth, especially the incisors, the canines and the molars. The submandibular can drain from the tonsils. The upper jugulodigastric can again drain from the tonsils. The middle jugulodigastric can drain from the pharynx, thyroid, and the lower jugulodigastric can drain from the larynx, again thyroid. The posterior triangle of the neck, just imagine the structures there and then you can answer the question. And lastly, the pre and the paratrachea, as the name says, trachea itself. 7th question, where do the axillary and inguinal group of lymph nodes drain? First you have to know what are the axillary group of lymph nodes. They are the anterior axillary, posterior axillary, central, lateral, apical. Where do they drain? They drain from the breast and the upper limb. Inguinal group of lymph nodes, there are 2, superficial and deep. Superficial is horizontal along the inguinal ligament, and the vertical group of inguinal lymph nodes are the deep nodes which drain from the lower limb. 8th question, name the different inguinal lymph nodes, already done. 9th, where does testis and ovary drain? Now testis and ovary, these are the gonadal organs, mainly abdomen or from origin. Ovary is already an abdominal organ and testis was earlier abdominal. So it drains into pre and para aortic lymph nodes. 10th, when does supraclavicular lymph node become palpable? In case of malignancy, either GI malignancy, lung malignancy, breast or gonadal malignancy. 11th question, what is Trousieurs sign and what is Virchow's lymph node? The left supraclavicular node, when becomes palpable, that is called as Trousieurs sign. And this left supraclavicular lymph node is only called as Virchow's lymph node. 12. When are the epitrochlear lymph node becomes palpable? In two conditions, in syphilis and cat scratch disease. 13th number, which group of lymph nodes are not palpable on physical examination? Then you can say retrosternal. You can do this by percussion but not by palpation. Second, the deep group of inguinal lymph nodes. Third, pre and the para aortic group of lymph nodes. 14th question, external and internal waldeyers ring. Now, external waldeyer ring is a normal waldeyer ring which you can see when you open the oral cavity. That is, above there is adenoid, then there is tubal tonsil, then there is palatine tonsil, and then lastly lingual tonsil. Now, how will you remember this? A is at the highest in alphabetical order also, so A will be high here also, so adenoid. Now, as you go down, you see the tongue. What is tongue called? Lingual, that is why lingual. Also, you have the palate below, so above the lingual is palate. So, the sequence is adenoid, then palatine, then tubal, then palatine, and then lingual. What is internal waldeyers ring? Internal waldeyer ring is that you can see horizontally, that is pre and the post auricular group of lymph nodes and the occipital group of lymph nodes along with the submental group of lymph nodes. 15th question, Hodgkin's and non-Hodgkin's lymphoma. I will give you a chart. You learn it and you can differentiate it well. Named nodes in our body. Remember 4. Wood's lymph node, Virchow's lymph node, clocked group of lymph nodes. So, Wood's lymph node is the lymph node which becomes palpable in the chronic tonsillitis condition. Virchow's is left supraclavicular. Clocked group of lymph node is the deep inguinal group of lymph node which is present in the femoral canal.